So I'm going to take you through my thesis, titled Fetomaternal Outcomes of Patients Followed Up at Preterm Surveillance Clinic. And this was done at Sally Mugabe FMU Hospital. So as an introduction, preterm birth is defined by the World Health Organization as delivery before 37 completed weeks of gestation, and it is a leading cause of maternal mortality and morbidity worldwide, with a burden of almost 15 billion births annually. And of these births, almost 2/3 are found in developing countries, of which Zimbabwe is one of the countries. And because of this, it remains a significant challenge despite advanced in prenatal care, and the complications of prematurity are not just found during soon after delivery, but also extend for those who survive into adulthood. So the preterm birth surveillance clinic offers a multidisciplinary approach in managing high-risk pregnancies, and their aim is to prevent preterm labor and optimize fetal-maternal outcomes. So our study aims to evaluate the fetal-maternal outcomes in patients who are being followed up at Sally Mugabe Central Hospital. So the objectives were to describe maternal outcomes and fetal outcomes, and to analyze the factors that influence maternal and fetal outcomes in the preterm surveillance clinic. This was an observational study which was carried out at the FMU from October 2023 to October 2024, and we included women with a singleton pregnancy with a history of mid-trimester pregnancy loss or preterm birth, or those who were referred after being found to have a short cervix, which is less than 25 millimeters on ultrasound scan. And these women consented to be enrolled into the study, and we employed convenient sampling. Our sample size was 125. We managed to recruit around 200 women. Of these, we managed to get full data for 150, which are the ones whose data we analyzed. And the sources of data included the FMU preterm surveillance clinic database, delivery registers from labor ward and theater, patients' notes, face-to-face and telephone interviews with clients, and ethical approval was obtained. So moving on to the results in demographics, the mean age was 29 years, ranging from 19 to 43 years, and majority of the women, they were married, Christians, and secondary school was a majority of women have reached a secondary school level of education, and there almost 58% were unemployed. On the antenatal variables, the median parity was 1, and gravidity was 4, with women having carried pregnancies, 2 to 8 pregnancies. And on terms of booking, the median gestational age of booking was 13 weeks, with 68% booking in the first trimester, and this is commendable because if we compare this with those from the city of Harare, where booking at the majority of patients booking the second and third trimester, but for these ones, they booked in the first trimester. And on follow-up of patients at the FMU, they were having 2 weekly ultrasound scan where they were having cervical transvaginal cervical ultrasound scan for cervical length assessment, and 94% of our patients were adherent to the scanning routine. And for the referral, majority were referred because of prior history of preterm birth or second trimester loss, while at least 8% were referred because of ultrasound scan findings. In terms of the interventions that were offered, we had progesterone, which was offered to 34.6% of our participants, and of these, only 71.2 received, and 28.8 who did not receive was because they could not afford to buy the progesterone. And for those who received, they were using 200 micrograms per vaginal nocte, and of these, only 20 patients were able to use progesterone from when it was prescribed up to 34 to 36 weeks. Some of the patients will only buy for 2 weeks, a month or 2, depending on their income. Cervical sacrilege was the most prescribed with 108 patients, and all of them were able to get the cervical sacrilege. For the cervical sacrilege, 86% were history indicated, and 10.1 were ultrasound scan indicated, and rescue sacrilege, which were for those who were found to have bulging membranes or cervical opening when ultrasound scan was 3.7. And coming to the complications, increase in vaginal discharge was in 36% of our of those who received cervical sacrilege, and the stitch failure rate was 13%, which is comparable to the published data. And of these, we used delivery before 34 weeks as a stitch failure on those who have cervical sacrilege. And corticosteroids were prescribed in 21, and 10 did not receive due to stock out at the hospital. Vaginal swabs were also prescribed for all patients, but none of our patients got because of lack of the swabs. And also of our patients, 35 were prescribed both cervical sacrilege and progesterone, and those who, all of them got cervical sacrilege, but 10 could not afford to get the progesterone. In terms of neonatal on delivery, we had 11 miscarriages, 40 preterm birth, and 99, which is term delivery, which amounted to 66%. And of those, if you look at the preterm deliveries, the majority were the late preterm and moderate late preterm, with 35% being the extremely and very preterm babies. And in terms of delivery, majority were normal vaginal delivery, and gestational age of delivery, the mean was 35 weeks. APGAR score, we used an APGAR score of 7 at 5 minutes. Those who were 7 and above were 95.6%. In terms of admission to neonatal unit, we had 21, which accounted for 15.1%. And of these babies, the majority, most of them were admitted for preterm and low birth weight, and only 2 were admitted for safekeeping due to maternal complications. And the birth weight only 7 had a low birth weight below 1,000 grams, and the majority, 79%, were in the normal range of 2,500 to 4,000, to less than 4,000 grams. And on day 7, neonatal outcomes, we had 81.3 who were discharged home, and 11 babies were still in the neonatal units, but unfortunately we lost 6 babies. So in conclusion, this was the first evaluation of the preterm surveillance clinic in Zimbabwe, and we were looking at high-risk women. And of these, 66% had term delivery, with over 87% of the babies being discharged home. We also noted early booking and high acceptance of cervical length monitoring, which facilitated timely risk identification and intervention in cervical sacrilege. And structured surveillance proved effective, though access to other interventions like progesterone, laboratory support, and corticosteroids remained limited. And these findings highlight the value of targeted surveillance and early intervention, improving fetomaternal outcomes. So recommendations would be to strengthen access to essential interventions, progesterone, laboratory tests like high vaginal swab, as well as corticosteroids, and also to scale up preterm surveillance clinic models to other centers. Parerenia now have a dedicated preterm surveillance clinic, and also longer follow-up of studies are needed to look at the outcome of these babies. Thank you.